There are a couple of significant milestones that you need to think about when treating hepatitis B patients. I think, like everything else in medicine, one of the critical things is engaging with your patient and developing a rapport and a relationship. So they need to trust you so they can ask questions openly, and then they can come to a safe place where they can get any information that they need and to feel comfortable to express any concerns. And then the first other critical thing is to make a decision as to, do they need treatment? And if they don't need treatment, what sort of monitoring do they need, and who is the best person to do that? Once you start someone on treatment, which can be very, very difficult at times, we have two groups of patients. One group who are desperate to start treatment and feels that if they start treatment, everything will be fixed. And the other cohort of patients who are really, really scared about treatment. And so there's a real fear and a barrier. So there is a reluctance in some people that if you start to offer them treatment or talk about treatment, they may just run away. And that's not an infrequent experience. And I've had that experience over the course of my career as well. Once you get them started on treatment, then they do pretty well. And then when they start to feel better or their liver tests are better, they can become a little bit complacent. And so we have a problem with ongoing compliance. So the whole question of how do you engage with your patient so they remember to continue their therapy long term can be a really difficult challenge. And some of the real challenges are those patients with advanced disease, where life gets in the way. An example is another patient of mine who was doing really well, and then he had children, and there were concerns about some children issues, and he had to be a parent, and his health sort of became secondary, so he let it slip and returned with a significant flare and progression of his liver disease. So they're the main issues: starting treatment and maintaining treatment. Stopping treatment is a bonus that we almost never really have to deal with, but usually that's a cause of celebration, and we don't really have a lot to worry about in terms of stopping treatment. I think there are lots of reasons for monitoring. One, they may think that there are side effects with treatment, that's one, and they think that if they came to treatment, the doctor will force them to take medications, which is a bit unfortunate. Or they forget, and then if they forget, they feel embarrassed to come back. Or they don't want to come back because they don't like you, they want to find another doctor, they don't trust you. And I think there's always this concern about cost. Maybe they can't afford it. So hopefully, we can explain to our patients that cost should never be an issue in terms of having ongoing access to treatment, whether they come and if they're, financial circumstances are difficult, whether they have free service or whether they go to a public clinic. There are lots and lots of ways. So cost should never really be an issue. But I think the other thing is whether it's job or family commitments, other commitments do get in the way. So we try and keep treatment as simple as possible. But they do need to have blood tests and ultrasounds, and they also then need to actually turn up for their appointments. And then they need to go to the chemist and pick up their drugs. So it can be really intrusive. So although we say it's simple, sometimes I don't think it's quite that simple if you're looking at having to do this twice a year, every year for a long, long time. I think that it's really important to engage with GPs. So where I have a GP who wants to prescribe and who's done the Hep B prescribing course, I'd be delighted for the GPs to be engaged. I think there are a cohort of patients who are better off or should consider being referred to specialists, and of course they're patients who have advanced disease. So anyone with cirrhosis, I strongly believe they should be seeing a specialist. But for those other patients who are well otherwise and have a really strong relationship with their GP, and we know that they have good compliance, I think they're absolutely fine to follow up with their GP. There is a sort of a model where you can do shared care. So some of my patients will come and see me once a year, so they feel that they're being supervised by me, and will see their GP in the kind of intervening visits. So I think there are lots of different models you can use to best, I guess, provide ongoing care that suits the person the best. I think, first of all, in communities where hepatitis B is common, I think it's so important that people know whether they have Hep B or not and understand what the disease is. So for those who don't have hepatitis B, it's really important for them to be aware that this is not a disease to be embarrassed about. There should be no stigma against it, and that it is just another infection that people should be very open and be knowledgeable about. And for those who have hepatitis B, I think it's so important for them to have literacy about the disease and try and ask as many questions as possible, understand where they're at. I think often patients will basically trust their doctor almost too much, in the sense that they go, oh, the doctor will know best. And they, if they don't tell me something, I don't need to know. But I ask my patients, please learn about your disease. Please know your disease. Not just know your condition, but know your disease, because hepatitis B is so complex that it changes all the time. It's really important how it may affect your life and why you need to be monitored, why you might need treatment, and why things can change, and what are some relevant key times in your life where you need to be really thinking about it actively. So that's the other cohort of patients. And then for the other cohort of patients who've got advanced disease, I think it's really important for them to understand about their treatment, about the frequency of their monitoring, why they're being monitored, and what sorts of things they're being monitored for, and be really engaged. I love my patients who come with a folder and have all their results with them, and they're like, some of them are really apologetic and say, look, I'm really sorry about this, but for my sake, I think it's one of the best things for them to be owners of their condition. So I always support health literacy, and the degree to which you are engaged with your own health will really improve your outcomes. So like with everything else, your physical well-being is important, but your mental health is really important as well. And I think it's really important for people to be talking about it. So I think dialogue about hepatitis B should be much more broad, and how hepatitis B impacts their health, but also how other health elements impact their hepatitis, and the interplay with all of that as well. Things like diet, exercise, physical, emotional health. I think all of those things should be actively discussed at each visit, and not just about, are you taking your pills? Have you had your blood test? It's all the other things. It's an encounter with a medical professional, and we should be able to do better and make sure that the patients understand it's not just about a blood test result, it's about the whole patient. So people talk about liver cleansing in lots of different ways, okay? So I think you can take liver cleansing and say just a really healthy diet can be a liver cleansing. So people talk about going on a detox. So they stop eating junk food and stop drinking. Fantastic. But I don't think you need to do anything extreme. I always say be sensible, and a well-balanced diet is important. General supplements like vitamins, vitamin D, which is something that a lot of Koreans take and a lot of Asians take, is absolutely safe. And I think there are a cohort of other kind of herbal remedies that people think are good for them. Before you take anything, check it with your doctor. I think that's the most important thing to take. People often think that herbals are safe because it's natural, but I do remind people that some of our most toxic chemicals that we use are natural. So please know what you're putting in your mouth, whether it's a herbal, whether it's a supplement. Just ask the questions before you take it, like you would with anything else.